Welcome, gentlemen. A recap on social indicators. We're basically going to be looking at the major social indicators in South Africa. We know that social indicators measure the social development and human welfare within a country. We know that in South Africa, we use institutions such as Str8 to produce development statistics, also the Development Bank of South Africa. When thinking of social indicators, we can basically think of three aspects: people, education, and their health. Yeah, that's right. This is the Lorenz curve. We know that the Lorenz curve is used to measure income inequality. It is an instrument used to measure income inequality. The curve closest to the perfect equality line form developed countries, whereas for developing countries, the curve is more on the inequality side of things. It has a bigger area of inequality. Let's have a look at the income distribution indicators. The Gini coefficients will possibly pop up, and we know it is an instrument also used to measure the income inequality. The Gini coefficient is calculated from the information provided by the Lorenz curve. So between 0 and 1, 0 being total equality and 1, all the wealth is in one person's hand. There's also the headcount index. Demographic information refers to information about the size and age structure of a population. So we now turn and look at demographic indicators, our second kind of social indicators. There are three different types of demographic indicators that we're going to look at. Population growth, now sitting at about 55 million in South Africa. Life expectancy of about 70 years in South Africa. And the Human Development Index, which is a socio-economic indicator of human development. Our next type of indicators under social indicators are very important. They look at nutrition and health. We know that nutrition and health are very important for each and every single country. Nutrition is an important indicator of the well-being of infants and young children. Child malnutrition can be expressed in terms of weights for age, of height of age. We'll have a closer look at these things. Health, we'll look at infant mortality rates, life expectancy at birth, live fertility rates, health expenditure, access to safe drinking water, access to sanitation facilities. Education is very important in South Africa. People's standard of living is directly related to their level of education. 5 or 6 years of schooling is essential for the achievement of sustainable literacy and numeracy skills. So the next type of indicator that we'll look at are education indicators. Public spending percentage. Wealthier countries usually spend lower percentage on education. Secondary enrollment percentage. This shows the percentage of the designated age group attending secondary education. Primary completion and youth literacy were the last two. Housing and services are also vitally important. In South Africa, the government usually provides RDP housing for the poor, those that cannot afford. We know that significant percentage, 49.7% of South Africans are poor and cannot afford to buy residential housing. Therefore, housing and services such as electricity, refuse disposal, water supply, sanitation are provided by the government. These are some of the basic services our people need. Urbanization is the increase in population, people moving into cities and towns. It happens because of migration of people, the natural growth of human population, and the establishment of new towns. So increased population in cities and towns results in these three things. It is a social, very important indicator. Government to understand where they need to provide their resources the most. So we have had a look at social indicators. Thank you, gentlemen.